Hey YouTube, welcome back to Exist Now. I'm Dr. Selin Santos, and today we're going to continue on speaking about death. I hope you got to see part 1 of my video as well as my introduction. If you haven't, go find them on my channel, okay? And at the same time, please remember to like and subscribe. So today what we'll be doing is we'll be continuing on our topic on death, and mainly having death phobia or living in a death phobic society. So let me pop up the PowerPoint right now. There it is. Okay, so I wanted to start off, as I've started off before, talking about certain topics about death that concern death with a quote. This is a quote that I found online that Edward Abbey said in a voice crying in the wilderness. He said, "The fear of death follows from the fear of life. A man who lives fully is prepared to die at any time." So this quote stands out to me because we'll be talking about something called death phobia and living in a death phobic culture, okay? So mainly, going back to the quote, I wanted to highlight a few things, okay? So the fear of death follows from the fear of life. As we might have mentioned on my previous video, this is life education, although it's been ascribed to in the, if you do a quick Google search, you click on life education, you won't find anything. However, on death education, you'll find a birth of topics and things of that nature that do with death and dying. However, not on life education. If we look at the perspective of life through death and understand that, hey, we all die at some point and we fear our own death, then mainly we're fearing our lives, of what it means for fulfillment and meaning and purpose, and finding out that once we put those aside, they fall by the wayside. Actually, we put those aside, we don't live life to the fullest, and so we fear that. And so we fear death. A man who lives fully is prepared to die at any time, right? So this is carpe diem, seizing the day, trying to do the best you can for yourself and enjoy every moment that you have. Because again, looking at death, we know that, hey, it's looming, it's coming. Might as well spend the best time of our lives while we're here. Of course, being responsible at the same time. I'm not telling you to go broke and spend all your money, right? So here in America, and usually in Western civilizations, meaning Western Europe, America, as well as Canada, what we see at the same time is there's this idea of this death phobic culture, okay? So death education has always been a controversial topic. Some individuals believe death should be a topic only explained at home or church. Similarly, people think this way about sex education, that, hey, we're going to leave that to the home and we're going to leave that for things to talk about in church. However, it is one of the things that I wanted to bring to light in these videos, that much of the time this idea of death, not talking about it, can therefore exacerbate it into being taboo, okay? Also, it's a controversial topic because many times death is emotionally charged, because no one really knows what to do. And when I say no one really knows what to do, is that there isn't groundwork and rules on what to do at the end of life. It's mainly all opinion based and based on families and their traditions, their rituals, their values. What is it that they typically do? And that's usually what is right for them. Subjectively speaking, meaning so that what you feel is right to do in your life is probably the better thing to do. Again, there's no definitive answers about the right approach about palliative care, assisted suicide, and passive euthanasia. When talking about these three things, you might ask yourself, hey, what the heck is palliative care? So palliative care means at the end of life, or when someone is faced with a terminal illness or disease, they rather have more palliative treatments, meaning they want to reduce pain and emotional turmoil rather than cure their disease, as many times there isn't a cure for their disease or their ailment at the point of time. So what ends up happening is, usually in hospitals, there's something called a palliative care team. And I'll talk to you guys more so of this in extent in another video, as this is part of this series on death and life education. And at the same time, so palliative care mainly, just focuses on easing the pain and easing the transition into the dying process, as well as hospice can help at that point in time, or if a person decides to go to a nursing facility or assisted living facility or stay at home and be cared for by their loved ones. As I was saying, there is no definite answer about the right approach at the end of life. There are some individuals who have asked questions about assisted suicide or medically assisted suicide, for those of you that know about this topic out there, or passive euthanasia. These are two topics that are very controversial and many times are illegal in some states and legal in others, as well as something called passive euthanasia. So that is where people are given certain medications or left to their own devices, and again, that's something that is disapproved in a lot of societies, a lot of communities. However, I do clinically and personally have heard of people asking their medical doctors for certain IV or medication treatments to have medically assisted suicide, although it might not be covered in that state, and some people end up moving to states where they have the right to do that. Also with passive euthanasia, right, that's not doing much of anything and allowing a person to pass on. These are, again, two of the most controversial ones usually in society, in our culture, in America. What we typically do is a person usually has a terminal illness and is taken care of by a palliative care team in the hospital, and also follows up with them in a palliative care clinic where they have specialized treatments, more so for, again, helping a person through pain and emotional turmoil rather than having a curative treatment. So death education also creates this social awkwardness, exacerbating this taboo status. So a lot of the times when individuals will talk about death among, let's say, family members or even friends, or even when making plans for the end of life, creating a will, that sort of thing, there's this tension, and individuals can many times feel it in the air and don't want to talk about those things. In my experience in the hospital, many times it was up to the palliative care team to begin those conversations because they were so difficult with family members, and have a bedside chat. Many times that's very helpful. However, trying to talk about life education at the same time, it's having that be comfortable enough to talk about in those settings, as well as even before a person gets to that point. So we'll be moving on to talking about something a little different, which is teachers on death education. So there have been instances where teachers attempt to educate the public on death. And here they usually have students write their obituaries and their wills, have students even sit in coffins. They will have students visit funeral homes and a crematorium, as well as have students see an embalming and touch a corpse. These again are things that are controversial because families might not approve of their child doing some of these things. However, there has been instances where performing these acts and having the experiential learning process go on, in which you experience death firsthand and you sit with the feelings revolving around death, can really go a long way in healthy bereavement and grief. As a person that has gone through some of these things will be able to talk about it with family members, have an open conversation about it, and be able to understand, hey, dying is a process of life, and I'm okay, and I'm glad that I got to speak to my loved ones in that time. And so there are differing opinions on that. So death as a phobic culture, usually I've seen this out of sight, out of mind. if it's not in the room, we're not sitting with the dying process of a loved one, then usually we don't think about it. I've seen people personally, again, and then clinically run around just to try to get a will fulfilled, or trying to make funeral arrangements, because at some point no one thought about this. And again, it's something that we put it out of our minds because we don't think it's going to ever happen to us, even though I think that's erroneous, because as again, as you heard me say in my first video, as we come to live, we come to die at some point. So people used to prefer to die at hospitals. This was based on my research, mainly in the 50s, 60s, and 70s. However, that idea is decreasing steadily. Right now, it's around 60 or 50% of people that die at hospitals. However, people are increasingly wanting to die at home with their loved ones, and so you see this idea of hospice care increasing in our society in America, which is a good thing, because then we are able to attend to emotions and people are able to be with family in the end. So it's a really nice and kind experience to be a part of. I've been a part of it, and I wouldn't change it for the world. So out of sight, out of mind. There are children in some families that are now allowed to attend funerals. Fewer and fewer people want to view the dead relatives at funerals. However, we're seeing some change, and one of the reasons I wanted to make this video is to start making these changes. Also, most people usually choose cremation rather than burial, and that is sort of this out of sight, out of mind, because it's kind of like, okay, at the end of it, I didn't make any plans. What are we gonna do? Okay, cremate. Then there's no funeral sometimes, and there might not be a viewing at times, which might be due to more economic reasons at this point in time. However, a person can choose what they would like, and me bringing this to light is having that choice in life rather than rushing around and trying to fulfill it at the end. So at the same time, people don't think about death because they try to keep the dead and dying at arm's length. I've been part of clinically, and again personally, part of hospice teams where a person's family might not come around because they fear death, and many times it's my kind of job as a psychologist, but again, I think it's my calling that to get people to recognize, wait a second, this is, my mother, this is my son, this is a person, a friend that I need to be there with. And so talking about those issues with dying goes a long way of having individuals understand that, wait a second, I want to be there. What does it mean if I'm not there? And asking these questions can help create healthy dialogue and understanding what it is that you want to do and what it is that you as a patient, let's say, want to talk about with that person. Again, death phobia comes from, even nowadays, we'll see rituals carried out are done with minimum effort or reflection. People are like, oh, I guess we're gonna have a funeral. Oh, maybe it's gonna be a cremation. They never said anything. We never talked about it. There's some minimum effort, and that minimum effort kind of turns into an exacerbation of the grief and bereavement process in a person, because it's kind of like, oh, why are we doing this? Oh, we don't know. This is just what we do. But that idea behind it, that reason for it, that purpose of it, isn't really spoken about. And so I wanted you guys to understand that. Okay. So with our death phobic culture, we understand that even with expectations on dying are a little interesting nowadays. So most individuals out there think, hey, it's our prerogative to live long. And when someone dies, some people even say, quote unquote, get over it. That isn't the healthiest thing to tell a person that's going through grief and bereavement of a loved one. And most of the time, a person even puts off death and dying. They don't want to talk about it. Again, it's all about living long. And that brings me to this next topic, quality versus quantity. We've seen in the research countless of times, even in in kind of clinical experience that most individuals want to live a good quality of life. When they see things happening to their bodies and changing, they don't want to not face it, but understand that, oh, this is irking me, it's bothersome, I'm not the same person I was before, I'm seeing myself deteriorate. And that can be hard for anybody. And so most of the time people understand for themselves that they want to live out the rest of their life as having quality of life and not quantity of life. So they rather live better, not more. So in terms of increasing life expectancy in the Western world, we can see that life expectancy is increasing a whole lot. However, this increases the risk of disease, disability, dementia, and advanced aging prior to death. Way back when, the life expectancy might have been around 69, 70, and as we see people progressing into the 70s and 80s, we see more people becoming demented and having issues because of advanced aging. So a lot of the times people are like, hey, I don't know why I'm here, and they ask these questions because they're living longer but not living better. So there is again this idea, and you see on my slide there, that there is a decrease of quality of life because public and private investment in medical research is usually focused on reducing death rates. So the focus is on increasing life expectancy by reducing the amount of times that someone gets sick or has a disease that can possibly lead them to dying. And on that note, I'm going to turn this off right now on the side here. Okay. So I understand that me talking about this is even bringing me down. So those of you out there that have decided to go on this journey with me and learn about death and dying, as well as, let's say today we talked about death phobic culture, take care of yourselves, go out there, have fun. Remember that this is life education. So it's one of those things, as we see the idea of death, we stare it in the face and we decide, hey, we're gonna live and decide to enjoy our time that we have here. So go out there and do something fun today, okay? And again, I'm gonna try to make more videos on this and maybe make them a little bit more chipper, okay? So those of you out there, please like, please subscribe. I said at the beginning of the video, but really do that. Please share this with other family members out there because it can go a really long way, okay? So as always, stay true and be you.